Hi everybody, I am Dr. Chandrasekhar. I am consultant shoulder surgeon and sports surgeon at Sunshine Hospitals, Hyderabad. Working in a premier orthopedic hospital in the country, we do come across patients from various parts of the country, especially those from the both Telugu states, Telangana and Andhra Pradesh, and also from other parts of the country like Karnataka, Tamil Nadu, Kerala, and sometimes patients even come from Kolkata, far off places like Kolkata, Assam, and all these places. Now, results after surgery in orthopedics, especially being involved in joint surgery, like I'm a shoulder surgeon, I do a lot of shoulder surgeries. The results depend a lot, not just on the surgery itself, but also on the post-operative rehabilitation, what we call it as, in layman terms, physiotherapy exercises after surgery. Even though most of the patients would comply with our exercise program and they end up having very good results, sometimes it happens so that the patients, due to lack of proper facilities, are coming from remote areas of the country where they don't have proper physiotherapy facilities, or sometimes due to negligence, or sometimes due to improper monitoring, they miss doing their exercises and end up having stiffness of the joint and inferior results of the surgery, which is not acceptable in today's world. And the breakthrough technology that came from Fiji, this remote joint motion, a joint range of motion monitoring device, has helped us a lot, especially in these pandemic times where the patient coming to the doctor itself is becoming a serious task or a dangerous task to the patient. And especially those living in far off places in the country or in the state, this device helps us to monitor the patient in real time, and the data comes to me to my mobile while I'm sitting in the hospital chamber. The patient is there in Visakhapatnam, or the patient there is in Kadapa, or the patient there is in Hyderabad, or the patient is in Gauhati, Assam. The patient's data comes to my mobile, and just by watching my mobile, I know the patient is doing the exercise program or not, and I will know how much exercise he's doing, and I will know whether he's following my protocol or not, or is overdoing exercises, or is not doing the exercise properly or not. And I can guide my physiotherapy team to talk to the patient immediately and to correct the program. And in case if the patient is not doing exercise, my team can get in touch with him and can counsel him regarding the importance of the exercises. And this has helped us in improving the joint motion and improving results. And I strongly feel that this technology has to be embraced by our orthopedic community and by physiotherapy community to have better results. And in 21st century, I think we have to progress ahead by embracing this innovative technology. So this device, this remote joint motion monitoring device, can be worn by the patient, and the patient can be anywhere in the world. And the patient's data, what are the range of motion is doing, and whether he's following my advice or not, or whether he's doing exercise at all or not, can be transmitted to me in my chamber into a tab or even in my mobile, where I can monitor my patient in sitting in the comfort of my own chamber. And it is not necessary that the patient has to travel long distances to see me every time for just for the sake of post-operative recovery. I can call the patient whenever it is necessary if I feel the recovery is not so good. And this also saves my time, where I need not see the patient repeatedly in my OP, where I can spend my time with some new patient rather than repeatedly monitoring the same patient again and again. And also in these pandemic times, especially the patients would like to avoid traveling and would like to come to the hospital repeatedly. This technology has helped us in monitoring our patients remotely, and this technology can be used even after pandemic also, where it saves the time of the patient, it saves the time of the surgeon, and monitoring can be very precise, and the physiotherapy program can be can have very good complaints, and that can be observed. Thank you.